Hello, how are you?
Hi, good.
My name is Lydia. I'll be your student nurse today, and I'll be doing an 8 to 12 assessment on you. I'll be asking you a few questions if you don't mind. Okay, could you tell me your name and date of birth?
Dejana Freeman, February 6th, 1990.
Okay, can I see your name? Okay. Do you have any cultural or spiritual restrictions I need to be aware of?
No.
And what is your preferred language?
English.
And do you have people involved in your care?
Yes.
How old are you again?
29.
Okay. So patient looks the stated age. She does not appear to be anxious. She's calm. She's maintaining eye contact. She appears to be well groomed. Her hair is well trimmed and combed. Her fingernails are well trimmed. She's well dressed for the occasion. She's clean, and she does not appear to have any body odor. Do you have any problems with swallowing?
No.
And do you have any problems with your senses or sight,
No.
smell,
No.
hearing, taste,
No.
touch?
No.
Okay. And do you have any issues with recognizing coldness or oddness,
No.
soft or hard?
No.
Okay. Do you know where you are right now?
Yes.
Where are you?
Camden, New Jersey.
Okay. And do you know today's date?
April 17th of 2019.
Okay. And do you know who the current president of America is?
Yes, Donald Trump.
Okay, so patient is awake, alert, and oriented to time, place, and person. She has a clear speech. She does not appear to have any slurred speech. Okay, could you look straight at me? Could you look at that part? And then when I say now, you look at my pen like now. Okay. I'm just gonna be. Okay, could you open your mouth? And your ears. Could you drop down your eyelids for me? Okay, so patient's sclera is white and moist, conjunctiva is pink and moist, oral cavity is pink and moist, and she does not appear to have any drainage or lesions in her mouth. She has no drainage from her ears and from her nose. Could you puff out your cheeks? Smile, frown. Patient has symmetrical facial expression bilaterally. Okay, so I'm just gonna shine this pen light to you. Patient's pupils are parallel, equal, reactive to light and accommodation. Could you hold out your hand for me? Give me a squeeze. Patient has equal grip strength bilaterally. Hold out your hand for me. And then I'll be applying a little pressure. Try and resist me. Okay. Your left leg. Your right leg. Patient has 5 out of 5 muscle strength bilaterally on both upper and lower extremities. Do you have any issues with cough?
No.
Any history of cough at all?
No.
Okay, so I'm just gonna take a listen to your lungs right now. And when you feel my stethoscope, just take a deep breath. Deep breath. Deep breath. I'm sorry, I'm just gonna. Deep breath. Deep breath. Okay. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Patient's lungs are clear on auscultation, both anteriorly and posteriorly. She does not appear to be using any of her accessory muscles to breathe. Her breathing is non-labored. Her breathing is regular and rhythmic. She has bilateral chest expansion. Have you been having any issues with chest pain?
No.
Any lightheadedness, fainting feels?
No.
Any palpitations like your heart is beating so fast?
No.
And are you able to tolerate your activities, your normal activities of daily living?
Yes.
And any fatigue?
No.
Okay. I'm just gonna take a listen to your heart. Your aortic? Your pulmonic? I'm sorry, I'm just gonna.
It's okay.
Your herpes point? Your tricuspid? And your mitral? Patient has a regular S1, S2 reading on all 5 at point. Can I see your fingernails? She does not appear to have any clubbing of fingernails. Can you stretch out your legs for me? She has a brisk capillary refill between 2 to 3 seconds. She does not appear to have any central cyanosis, and she does not appear to be diaphoretic. Okay. Have you been having any issues with your walking? If you walk, do you feel pain?
No.
And any calf tenderness?
No.
Can you just sit up for me and then lie down? Okay, so I'm just gonna feel for your temperature. Patient's skin is warm, dry, and it's dry and intact. Color distribution and hair distribution is equal on both upper extremities and lower extremities. Patient does not appear to have any edema, both on both upper extremities and lower extremities. I'm just gonna feel for your pedal pulses. Okay, and your radial pulse. Patient has a +2 radial and pedal pulses. Have you been experiencing nausea, vomiting, diarrhea recently?
No.
No. And when was your last bowel movement?
Yesterday.
And what was the consistency
Formed.
and the color?
Brown.
How about your bladder control? Are you able to control your bladder?
Yes.
And the last time you went, what was the color?
Yellow.
And your bowel movements, like how often do you go?
Every 2 to 3 days.
Okay. So I'm just gonna be assessing you. Patient has no drains, no catheters, no osteomies. She umbilicus is midline. So I'm just gonna take a listen. Patient has active bowel sounds on all 4 quadrants. I'll just be palpating. Tell me if you feel any pain. Any pain? Okay, so patient has no pain, no lesion, no tenderness, and no distension. I'm just gonna be palpating your bladder. Any pain? No pain. Okay, so patient has no pain, no distension, and no tenderness. Okay. Do you have any history of skin disorder or skin diseases? No. Okay. Like I said during the peripheral assessment, patient's skin is dry, warm, and intact. Can I see your elbows? Okay. Could you turn to the side, please? In the sacral area, and then the heels. Patient has no breakdown on all bony prominences. I'm just going to be assessing your skin toggle. Patient's skin is elastic. Okay. Could you sit up for me? Do you have any issues with your mobility? Do you need assisting devices when you move?
No.
Okay. And any history of falls?
No.
Any joint pain, muscle pain?
No.
Okay. Could you raise up your hand for me? Okay. Could you raise it to the back of your head? Your hand up again. And then to the back. To your head. And then to your back. Okay. Could you kick out for me? Then can you point it to your toe, to your nose, and then flex, extend it? Okay. Patient has full range of motion. Thank you.